here I am defending juice again for some reason. Not quite sure how we got here, but here we are anyways. I want to talk about this comment on my video comparing the nutrient density of juice versus the whole food that juice is derived from. Is drinking juice going to negatively impact blood sugar regulation, insulin sensitivity? Is it going to lead to type 2 diabetes? Is it a silent killer? Actually, the scientific community has aggressively pursued this question for about the last decade. And the reason is that there is an established link between the consumption of sugar-sweetened beverages and increased risk of obesity, type 2 diabetes, cardiovascular disease, and total mortality. And a glass of juice does have a very similar sugar content to a glass of soda. But studies have failed to show an increased risk of developing type 2 diabetes from fruit juice consumption. I will put links to important studies for you to go look at in the video description. But for example, a large 2015 meta-analysis that pooled together from a bunch of studies showed that while there was an increased risk of developing type 2 diabetes from sugar-sweetened beverages, the difference with fruit juice was not statistically significant. There have also been a bunch of randomized control trials that have tested fruit juice consumption and how that impacts blood sugar regulation and markers of insulin resistance. And in fact, there was a 2017 meta-analysis that pooled together data from 18 randomized control trials and showed that juice consumption had a null effect, neutral effect on fasting blood glucose, fasting insulin, hemoglobin A1C, and the HOMA index. So studies show that fruit juice is not going to cause insulin resistance or type 2 diabetes. And in fact, studies show that moderate juice consumption does reduce all-cause mortality. Remember, my video from yesterday shows that the sweet spot is 150 milliliters per day.